Good afternoon everybody. Shubha Aparanna, Samasthyanku Kumar Namaskar. I bring the greetings from Kalinga Institute of Medical Sciences, which is one of the part of KIT deemed to be the University, Bhubaneswar, Odisha. So in the next half an hour or so, I will try to convince you why we all need a healthy liver to lead a healthy life. Introducing me, I am Dr. Ambika Mohanty. I am a professor in medicine and the principal of KIMS, Bhubaneswar. I did my MD and DNB in internal medicine from FMC, and also I am a fellow of Indian College of Physicians and in fellowship of Indian Society and Gastroenterology. As you can see, a healthy liver lies in your hands from this diagram. If you can look after it, it will be healthy. If you don't look after it or neglect you, it will definitely also not look after you. So, why is liver essential for health? Liver as such is a silent worker which keeps on working 24/7, and unlike other diseases, when somebody gets a heart attack, he has got severe pain, rushes to the casualty. Somebody has got paralysis or a stroke or a brain attack, his relatives, they carry him to the casualty. Whereas in liver diseases, there are a lot of misconceptions. People say that liver usually doesn't go bad, or they usually seek the alternative system of treatment like some Ayurvedic drugs or other drugs. It is a big organ, and simultaneously it is very difficult to locate where it is from outside. It usually lies behind our ribs and sometimes even difficult to examine or pointing out by the patients as such. So, what does the liver do then? Heart pumps the blood, the so-called brain gives us memory, but liver does around 500 functions for which we are not aware of. Out of these 500 functions, I will only highlight few. That it helps in digesting our food. All that we eat to the mouth, all has to pass to the liver. It removes some of the waste products. It also produces the protein. It also uses food for the energy, stores some vitamins, and also removes the poisons and drugs if are taken in some moderate amount. If the drugs level exceed, it fails. Briefly, common diseases of the liver I will tell you. The diseases could be one of these 7. In the center, as you can see, it is an acute liver failure which is not that common, but on the top, so-called the viral hepatitis is very common in the children. Fatty liver is an epidemic in the whole world. In India, the prevalence of fatty liver is around 30 to 40%. Alcoholic liver disease is very common. It is a man-made disease. I will describe that subsequently. Cirrhosis of the liver is almost a terminal condition which often leads the transplant, or sometimes patient dies without a transplant. Drug-induced liver injury, what we call DILI, is underdiagnosed because patient often doesn't give any history, and usually it presents very late, and some of the drugs like Ayurvedic, which got heavy metals, they can cause DILI. Liver abscess used to be very common before, but the treatment is very easy if the pus from the liver can be drained. Then coming to what is the cause of all these diseases? As you can see from that last slide, that infection can cause viral hepatitis, alcohol taken in excess can cause alcoholic liver disease and cirrhosis, drugs can cause drug-induced liver diseases, the metabolic conditions like diabetes, obesity can cause fatty liver disease, and also subsequently it can lead to cancer of the liver. Now, how do you know that you have a liver disease? It is often misdiagnosed, late diagnosed, and wrongly conveys to the abdomen or to the chest. So, liver disease, the symptoms are usually non-specific. One can only give the weakness which is so common in the society. There may be loss of appetite. The patient often doesn't see his eyes, but sometimes the relatives see that the eyes are yellow, so they point it out to the patient, or the skin in late stages can become yellow. In late stages of cirrhosis, the swelling of the abdomen, a lot of fluid accumulates inside the tummy and it cannot get excreted. There may be swelling of the legs and the itching of the skin. There may be small bleeding on spots under the skin called bruising, and sometimes there can be vomiting of blood or passing black stool, which is usually bleeding in the GI tract. This is one of the diseases I want to cover first, called viral hepatitis. It used to be rampant in the past. Viral hepatitis are usually due to 4 viruses, that is A, B, C and E. A and E are usually water contamination to the food or contaminated water, and B and C are usually blood transmitted, that can come from the blood transfusion, IV drug users, sometimes due to unprotected sex like AIDS. So, non-specific symptoms can be low grade fever in viral hepatitis, which disappears after some time, and then patient has got loss of appetite. They can have some tendency to vomit or even vomiting. One of the peculiar features of viral hepatitis is called aversion to smoking alcohol. An alcoholic stops alcohol. A smoker usually don't like the smoking. That is one of the signs that you can find out, does he have a liver disease? Rarely there may be pain in the right upper abdomen, and LOIs, as I said, can be noticed by the relatives or by the patient himself. Second thing, fatty liver, as I said, is very, very common in the whole world. There are a lot of talks, debates are going on. Fatty liver can be due to alcohol, called alcoholic fatty liver, or it can be also without alcohol, again called non-alcoholic fatty liver. There are a lot of controversies, as I said. If can lead to cirrhosis, cancer of the liver after 30 to 40 years. Usually, the no symptoms you detected when the patient or a person goes for a body checkup or medical checkup, or detected on routine examination on the ultrasound. This is a diagram, as you can see on the extreme left of mine is a fatty liver. You can see the liver is swollen up, but surfaces are smooth. After some time, it can cause inflammation called steatohepatitis or NASH. After some time, many years, it can cause cirrhosis, that is called a fibrotic liver. You can see some nodules on the surface of the liver, and finally, it can cause cancer. That is why this fatty liver has become a very concern in the present society all over the globe. It only can be diagnosed an early ultrasound suspicion. Fibroscan is available in most of the places like our place. Some blood tests can give a hint, but ultimately the final diagnosis usually needs a liver biopsy for research purposes or for treatment purposes. Lot of drugs are being tried all over the world. However, as on date, there are no approved drugs, but still people have been using vitamin E, people have been using glitazone, saroglitazar, UDCA and some drugs. The third disease is the alcoholic liver disease. You can see from the picture, the patient who keeps on taking alcohol, if he develops jaundice, he should be careful. There may be some pain in the abdomen, the swelling of the abdomen due to accumulation of the fluid. He gains weight, he should not be very happy if he gains weight, but if he gets tired, vomits blood or passes dark stool, one should suspect. It can have initially fatty liver, but subsequently it can go to cirrhosis or even cancer of the liver. The duration of alcohol or the ethanol use and the amount also is not very certain, but the country liquor, one should realize, is worse because of some adulterants which is added up, and it should be avoided. Diagnosis of alcoholic liver disease, often the patient don't turn up to the doctor. He is quite comfortable in having initially drinks in the evening, then drink in the evening and the lunch time, and finally in the morning, and that becomes definitely warning, but he usually finds difficulty in stopping. It can be suspected by the relatives to be sent to the doctor, and doctor can diagnose by the history and often doing a blood test or an ultrasound of the liver and abdomen. Sometimes an upper GI endoscopy, what we call gastroscopy, will be required to find out some dilatation veins called varices and affection. The one disease which had put in the center of that spectrum is called acute liver failure. It is not common, but very dangerous. It usually presents suddenly due to some particular conditions I will come subsequently, and invariably it leads to death unless action is taken or a transplant is done. So, one should be careful about this disease. It can occur in hepatitis viruses like hepatitis B, hepatitis E in pregnancy. It can occur with some drugs or some poisoning like paracetamol overdose. Even also it can occur in autoimmune diseases and other diseases. This, of course, as I said, the symptoms are acute. Often the patient becomes delirious, it becomes drowsy and loses consciousness. Proper diagnosis, finding out the cause, removing the cause, if it does not help, usually patients have to undergo a transplant, which is usually saves the life. Often we have seen in our countries or some developing countries, even malaria, dengue, some of the other infections can also present in acute liver failure, and it has to be noted usually to be brought to the hospital and admitted. Cirrhosis of the liver. Cirrhosis means the liver becomes small, it looks like a knot or surfaces are having nodules and loses almost all the functions. This is a very deadly disease. In our outpatient and indoor, we see almost plenty of cirrhosis of the liver, because most of the time it has reached a stage which cannot be reversed, and subsequent stage is the malignancy, but a patient can also die of cirrhosis because of bleeding, because of infection, and sometimes massive bleeding from the esophagus or the stomach. Similarly, the symptoms are few, but as I said, these patients usually turn up unless brought up by the relatives to the hospital, because patient gradually deteriorates. It can also lead to malnutrition. This is one of the disease that cirrhosis patients puts on weight. He is 50, he puts on 5 kg of water, he becomes 55, but not to be happy, because he also develops malnutrition because he does not feel like eating. He does not also eat. Alcohol is the only food for him, and sometimes it can cause edema of the brain, causing convulsions or seizures, and also he becomes unconscious or comatose and can die. The treatment is actually of cirrhosis is to prevent it, or if he has gone that beyond stage to stop the alcohol intake. If the stomach or the abdomen is bloated off, to give some comfort, we keep on taking fluid periodically from the abdomen, and of course control bleeding from the stomach by a procedure called sclerotherapy through the endoscope, and of course it does not respond, it dies within few years, but it can be given offered the prospect of liver transplant, which can definitely cure the patient. You can see this from picture. The abdomen is bloated up due to fluid accumulation, patient becomes very uncomfortable. This is called ascites. He also can have swelling of the feet. Sometimes a hernia occurs from the center of the abdomen because fluid pushes the intestine out. It can be an emergency, sometimes it may have to be operated. I spoke about the malnutrition and cirrhosis. They do not eat, they drink, they neglected by family at times, so they become very malnourished. So, their mortality or their outcome is related to the nutritional status. There have been studies, if they are fed well, their survival is slightly better. They should avoid some diet and also take to diet, but again the problem is the so-called the loss of appetite. It has been seen, if you give them some particular food in the evening time, like called some high caloric diet, some juice, maybe some chocolates or butter, the turnout is slightly better. The next disease, DILI, what I said is the DILI. It is not uncommon, but lot of patients do come very late. Somebody is consuming, let us say, Ayurvedic drugs containing heavy metals like mercury, arsenic, all that. They have got called drug induced liver injury. What in practice we see, when somebody started on the anti-tuberculosis drugs, they are usually hepatotoxic. Some of them also develop daily, which can be reversed if you stop the drugs. Some of the antibiotics also they can damage the liver. Then commonly used paracetamol or painkillers are one, and as I said, so-called complementary or the alternative drugs are there. Onset usually very slow, it can manifest after months or year, and usually the patient has forgotten what drugs he has taken in the last 6 months or 1 year or 2 years, and presentation is similar: weakness, fatigue, pain abdomen, late jaundice, and this can be prevented to large extent if the drug is stopped and care is taken. It is by exclusion actually. When somebody comes with this type of problem, you have to rule out viral hepatitis, you have to rule out malignancy, you have to rule out all infections, and some of these heavy metals called antidotes. Let us say paracetamol got the antidote called N-acetylcysteine, and finally, if doesn't respond to anything, liver transplant is the only answer for dealing. This is a deadly disease, the cancer of the liver. Again, unlike other cancers which is very easily diagnosed, a mouth cancer, tongue cancer, breast cancer can be easily diagnosed outside, but the liver cancer is difficult to diagnose. Again, the onset or the beginning is very slow, it comes over a period of years. One has to diagnose cancer most of the time is during screening or those cirrhotic patients who come for checkup. And here you can see the picture is an MRI of the abdomen. You can see there is a whitish nodule sort of thing in the lobe of the liver. It has to be a liver cancer. The causes, as I have already said, cirrhosis, fatty liver or so-called viral hepatitis. Diagnosis is usually by screening or by imaging. Biopsy is rarely required, and of course, the treatment has sort of transplant or other options. Liver abscess, as I said, it used to be common that two types of organism, one is called the amoeba, what we call amoebiosis, or by bacteria, that pus forms inside the liver, the fever, pain abdomen, but once you diagnose, it is very easy to cure. You take out all the abscess and becomes all right. Rarely a surgery is required. In India, we often see patient comes with fever, then he develops jaundice, and then while investigating we find his malaria. They respond to the malarial drugs. We see amoebiosis to liver abscess, they respond to the amoebicidal drugs. Dengue, which is still in the country also, you treat dengue and the jaundice disappears, similarly as the typhoid or the enteric fever. Now, how to diagnose? I have covered to some extent. The diagnosis of liver disease will all depend initially on the suspicion by the patient, by the doctor or by the attendants. Usually the doctor looks for what? He looks for the LOIs or the jaundice. He palpates the liver, find out the size of the liver, or feel the liver is there in fluid in the abdomen, or sometimes he does some tests. The first is called a liver blood test called liver function test. There is a battery of tests. Ultrasound is a bedside investigation. Fibroscan is available. Often CT and MRI may be required for that thing, but it said prevention is better than cure, is quite apt to the liver diseases. If somebody vaccinates to hepatitis B, he doesn't get hepatitis a lifetime. He controls weight, take the right food, clean water, not necessarily filtered water, of course no alcohol, avoid over-the-counter drugs not prescribed by the doctors, and that will of course prevent the disease. This is a diagram how to prevent viral hepatitis: clean water, drinking, clean food and good hygiene. Then suppose something, the diet and nutrition I have already said. I will say little bit about evening snacks in cirrhosis. You give him sprouts, egg or fruit in the evening. Antiviral drugs can cure viral hepatitis. Stopping drugs in fatty liver can stop it. Alcoholic liver disease have got a few drugs like steroids. Cirrhosis of the liver has got some drugs, and most of the diseases, if not properly treated, will require liver transplantation. So, tips is exercise regularly, wash your hands which can prevent waterborne diseases, wash for the needle injuries, tattoos, shaving with a barber, or take the correct medicines, avoid too much of paracetamol and avoid some drugs. Tattooing I have already said, vaccination I have said, keep a good body weight. Usually body weight what we decide not by the weighing machine, the waist size called 36 32. It should be less than 36 in a male or 32. I will be happy to take questions in case there are some questions, but ultimately what will happen that I will only stress upon this last point. People say alcohol is good, alcohol drink only moderation, nothing happens, but I will only say this: never take this alcohol. When studies have found out little alcohol is bad. This is my last slide to say that stay no to alcohol. I think that will be sort of preventing large extent the liver diseases. Thank you. Any questions I will take over now. The liver transplant has become available in most of the centers in our country, even our center, and it should not become the practice, but liver transplant once is required, it gives a good quality of life to the individual, to the family, and quite good well-being. But alcohol in all types of things has to be avoided and stopped. Mr. Abhinandan Behra, thank you. Are there any lifestyle factors that can negatively impact liver health? I think the topic has been only on the lifestyle factors I have said. Lifestyle is first is they maintain a good weight. Lifestyle is do moderate exercise. Lifetime is alcohol. Lifestyle is take proper food, good food, clean water, and of course lifestyle will be some meditation, that will definitely go a long way to prevent not only liver diseases, other diseases also. Mr. Saurabh Patra, how can stress management and sleep quality impact liver health? Directly stress does not affect the liver, but you will agree that stress can cause hypertension, stress can aggravate diabetes, stress can also aggravate your lifestyle, like let us say you do not do any exercise, you always are depressed, and maybe that stress also subsequently leads to some bad habits, some ethanol, some drugs and loneliness. These are negative factors, not direct factors. प्रभस्विनी नायक आपण पचारिचंती यकृत रे समस्या हेले केउ लक्षण गुड़िक प्रति सचेतनता हेबा उचित। मु कहि सारिछि आपण को जे यकृत रोगर लक्षण किछि सीधा यकृतर नाही। जेमति आमे कहिबा जण को ट्यूबरक्लोसिस हेछि तार काश हबो, कफरे रक्त पड़िबो, सेमति यकृतर सीधा किछि लक्षण नाही, किंतु आपण देखिबे जदि किछि दिन हेला रहुछि त दुर्बल लागुछि, भोक करू नाही, बांती होची, बांती देखौची एवं शेषरे जदि तार आखि हलदिया होची तांको सीधा डाक्टर को देखिया कथा, घरे किछि चिकित्सा करिवे नहीं, तापर हुए तो किछि पिला मानक संगे टिके धड़ा स्टूल हुए झाड़ा हुए, एगुड़ा सब लक्षण नहले प्राय लक्षण बहुत डेरी आसे। Mr. Barik, what are the basic indicators of liver diseases in an individual? Basic indicators, what we say actually in the scientific terms, is the liver function test. I said there are 500 functions, but blood tests can pick up the synthesis functions. The two blood tests will say the liver is synthesizing all the proteins. There are some tests that can say liver is not excreting bile. Some tests can also find out what is the degree. So one is called serum bilirubin, one is called AST, one is called ALT. Some of the virus also in the indicators can be virus is causing viral hepatitis. Then you have got some factors like let us say other investigations, as I said, ultrasound, fibroscan, CT, MRI. There is one test, particular test called alpha fetoprotein that can also help in diagnosis and monitoring liver cancer. This is one of the indicators which is very helpful. But ultimately what we covered up is that this health is in our hands. As I showed a picture, there are two hands in between the liver. You keep it properly. Don't harass it with a lot of toxic materials. Let us say paracetamol is very helpful, but don't take more than 10 tablets per day or something. It will get damaged. That will cause acute liver failure, and patient may not be able to afford a dialysis or something. There is a question, are there any alternative therapies or natural remedies that may support liver health? Mr. Abhishek, this question actually is a nice thinking process. As you know, in our ancestors, they are also healthy. They had some practices of food. Can we go back to that? It is very difficult. They definitely had a lifestyle where they used to work almost 12 hours. They eat whatever is available naturally. We don't have that. So anyway, this is also required, but I think some research has to be done that what is good in particular so-called, let us say, haldi or some other thing, that research is required, and that will definitely help. As on today, because science also doesn't believe, they believe in some other thing that is happening very fast and maybe economically viable. किए कहते गोटा मिस्टर महांती क्वेश्चन होची मु किपरि मोर यकृत स्वास्थ्य उपरे नजर रखि पारिबी एवं मु केते थर चेकअप किंबा परीक्षा करिबा कैंसर तांकर चेकअप दरकार किंतु मो मतरे आपण गोटे चेकअप करि पारिबे जदि आपण वैक्सीन न नै थिबे कि आपण हेपाटाइटिस बी और हेपाटाइटिस सी आपण आगुरु इन्फेक्शन अछि नै बहुत सिंपल टेस्टा जदि सेथरे पॉजिटिव थिबो जदि आपण तार मेडिसिन मिलुची आजिकली बी रो आ सी रो hepatitis C will be completely cured and hepatitis B can be controlled. So this checkup you do as per a hepatitis B and C, and you can have one liver function test, and then you can repeat if there is only symptoms of jaundice or any swelling of the abdomen. Asha Naik, the question is, what are the common risk factors for liver diseases and how can I reduce my risk? You don't have to worry your risk. If somebody is overweight, reduce it to normal. If somebody has got diabetes, control your diabetes. If somebody had a family history of liver cancer, please go for regular checkup. But otherwise, the other risk factors could be completely sedentary style. The risk factor could be your so-called ethanol abuse, stop it. And if there is a common going to barber shop or taking some other things, you can stop it, and you can definitely prevent, which is preventable. मधुमेह किंबा उच्च रक्तचाप भली पुरातन रोग आमर स्वास्थ्य कौन प्रभाव पकाई थाए रक्तचाप लिवर डिजीज सांगे रिलेशन किछि नाही किंतु केते गुडे रक्तचापर मेडिसिन जोटा आम कहू एंटी हाइपरटेंसिव ड्रग्स ताहा ड्रग इंड्यूस लिवर इंजुरी करि पारे किंतु डायबिटीज आपण मन रखु हो तो गोटे मोर उपदेश जो मैंने डायबिटीज तांकर फैटी लिवर बहुत कमन डायबिटीज ड्रग कंट्रोल कले फैटी लिवर कमिज बा भल हो थैंक यू एंड थैंक्स फॉर द पार्टिसिपेशन एंड आई एंजॉयड बीइंग विथ यू थैंक यू